Get Ahead of Stroke it's a campaign that was created in 2016, really to for the same reasons as mission thrombectomy, to expand access to thrombectomy care, focused really in the United States. Um, for the background, as I said, it's an advocacy and education campaign to improve stroke systems of care in the United States. The goal was to, or is to ensure that eligible patients have timely access to thrombectomy, no matter their zip code. And at the time in 2016, Rhode Island was the only state with updated protocols for effective assessment, triage, transport, and treatment. And today, as a result, in part of the campaign, 41 states have updated protocols, partially or statewide. And so perhaps this can, this review can help other countries sort of see an example of how this is done, although systems are different across the world, and a lot of change has to be done in local context of local policies and regulations and laws. And so at the time there was this, at that time the evidence for thrombectomy had come out in 2015, and as Dr. Joven reviewed, evidence continues to come out, and scientifically this is proven to be a highly efficacious and cost-effective treatment. And but we were noticing, and in the United States, that patients were there was significant disparities geographically with how the delivery of stroke care was done. And so the question was, how do we get the treatment that is really only available at thrombectomy centers, specialized centers, without compromising global care of stroke patients? And so just to show how this looks like in a part of the United States, northeast part, there's many primary stroke centers, and there were fewer comprehensive stroke centers which had the thrombectomy capability. And there was patients were the patient transport algorithms were and continue to be in some parts of the country to bring patients to um, centers, irregardless of whether they can offer thrombectomy or not, as long as they were stroke centers. And I don't know if you can see, but in certain parts of the country, even in New York City, where I work, thrombectomy centers and primary stroke centers are very close to each other. So if you have a large vessel occlusion patient, there's no downside to transporting them to a place that can offer thrombectomy, but this was not often performed at that time. And so the campaign came about this idea of creating transport protocols for patients in region by region that would make sense to get the patients to the closest center. And so the Get Ahead of Stroke campaign really approached this on multiple prongs. So advocacy via publications, via legislative approaches. In as background, the United States is very much not a United States, but a conglomeration of 50 different states. And actually, these sort of triage protocols are determined on a local basis or a statewide basis. So this required really going into grassroots, into state legislatures or state Department of Health to advocate for this sort of change. And then in order to get that to be effective, education was necessary. So educating the EMS community on triage tools, triage protocols, is part of the campaign, educating the medical community, and then also having public awareness, so targeting patients, on social media, doing sort of a public campaigns, having patients get onto things like talk shows to talk about the differences that can be accomplished when triage is done was very important. So yeah, so this has been done again for the last 9 years across the country. Some examples that have come out of it. So this publications, the standards of practice in acute ischemic stroke intervention, international recommendations. This was a paper that was done in collaboration of many of you that are listening around the world. And the idea was basically to create this sort of uh, breakdown of stroke centers and make it sort of akin to trauma centers, so that a level 1 stroke center would be where you can perform thrombectomy, and there would be that would then allow for appropriate triage protocols to be created. And so this paper was published in 2018, and this is out there. And then, as I said, a lot of the work of the Get Ahead of Stroke campaign, which was done with, just to mention, in collaboration with patient organizations and sponsored by as mission thrombectomy by industry partners. And with that, we were able to have PR, have some collaboration or partnership with PR firms and lobbying firms to organize some of these activities. And so, one thing that we've done a lot, and this is some pictures that I've had, and this is just from me because this was done individually by physicians in all many of the states. And so one big thing is that we did organize advocacy in Washington, D.C. several times. This is a picture of Jay Maka and myself in front of our senator's office in Washington, D.C. And we took several physicians and arranged for each person to meet with their state senator in DC or the representative most of the time and discuss this sort of thing. And then again, each physician, we arranged for a trip to the state capital, Albany, to again talk to their Department of Health and legislature if it was necessary to try to change legislation regarding EMS transport and stroke centers. Some of the achievements. So again, now I think is a testament to this campaign, as well as work by all of us around the country. The eligible ELVO patients are receiving thrombectomy more and more. We also work to secure language, which within the EMS, now the EMS has a national organization that puts out guidelines. So we worked really hard to have them adopt language that incorporates EMS field triage and assessment. And so that's now a model for several states that want to incorporate this in their state guidelines. And again, the SNIS members have conducted hundreds of media interviews and participated in numerous legislative sessions and meetings to talk about the effectiveness of thrombectomy, the importance of being able to designate hospitals, which again is a state-by-state activity in the United States, and the importance of severity-based triage and transport. And then as part of the education, looking at EMS apps, looking at this EMS app that we launched in 2018, it's gotten downloaded tons of times. We've launched Survive Stroke Week, which is in May, and that's a point in the year that we put out a lot of social media and target stroke education. And this year we promoted to Spanish language speakers Rapido for stroke triage. And we continue to host the EMS trainings and workshops locally. So again, for in the United States, this campaign is, the point of it is to engage state decision makers, hosting EMS trainings and nationally and locally, sharing educational resources with consumers. These are all things that we hope that people can do locally to inspire change. And a lot of this material is on the Get Ahead of Stroke website, which the address is down here. We are doing global work that's partnering with you guys would be great, and I'm glad that this is becoming it's taking on such a huge role. We are also part of the Wifton Federation Assembly that Dr. Orbach was talking about, and recently we've launched some similar things such as e-fellowship, where we can have televised cases to practitioners around the world for education. But so that's a summary of everything that SNIS has been doing with the Get Ahead of Stroke campaign. And I'd like to thank you, and happy to answer any questions. You can email me